Thank you for coming today. Utah communities are dealing with a frightening public health crisis, the fact that the rate of suicide in our country is increasing. Utah has the 6th highest overall rate for suicide in the country, according to the Center for Disease Control. Young people are especially at risk, a cruel circumstance since they are the hope and promise for the future of our communities. Suicide is the 2nd leading cause of death overall among those aged 15 to 24. When a young person causes suicide, it causes heartbreak for family and friends and devastates an entire community. They're left to wonder what, if anything, could have been done to prevent it. We can and we should do more to understand what puts a young person at risk of tragically ending their life. This is a multifaceted challenge, and it will take work from numerous perspectives, and that's what we came together today to do in a roundtable with people from state government, from the private sector, from our communities, from our schools, to talk about what we might do to prevent future deaths by suicide. We know that in Utah we need more mental health treatment counselors and providers for individuals in crisis. I've worked for more funding for our current mental health professionals, such as those who staff the suicide prevention crisis line and those who assist law enforcement and others with a response to mental health emergencies. And today I'm coming at this challenge from yet another perspective. I've introduced an important piece of legislation with the goal of understanding why the rate of Americans dying by suicide is on the rise. Why, after a stable period from the year of 2000 to 2007, why did suicide rates for children and teens and young adults increase from 6.8 deaths per 1,000 to 10.6 deaths per 100,000? My legislation directs the National Science Foundation to award grants to colleges and universities and nonprofits to support research about what leads to suicide attempts. It could be social and economic factors, technology or stigma associated with mental health conditions, or a combination of things, even genetic factors or geographic factors that also are correlated with a risk of death by suicide. And despite progress in mental health and behavioral health research, current gaps exist in our scientific understanding of mental health, the human brain, and effective care and treatment. We need to fill in those gaps in order to address this crisis and ultimately to find the solutions that will save lives. Researchers need more funding, and they need more support to conduct the foundational research needed to give healthcare professionals new and better tools. The annual federal budget for the National Science Foundation is $6.5 billion. My bipartisan bill, as a member of the House Science, Space, and Technology Committee, I've introduced it with Ohio Representative Anthony Gonzalez. It directs the National Science Foundation to prioritize funding for suicide prevention research grants and also to encourage more individuals to pursue suicide prevention research at the beginning of their careers. This legislation has the endorsement of the American Foundation for Suicide Prevention and the American Psychological Association. We are fortunate here in Utah to have an expert in Dr. Doug Gray, someone who's been doing this work for decades and really puts Utah on the forefront of research into suicide prevention. He's a professor of psychiatry and the vice chair for training and education in the psychiatry department at the University of Utah's School of Medicine. Dr. Gray is involved in many suicide prevention programs across the state of Utah, and he currently serves on committees appointed by the governor and the Utah State Legislature. So Dr. Gray, if you could speak about research gaps that we need to fill. Thank you.
Sure. First of all, I'll give my thanks to Congressman McAdams for the emphasis on suicide research so we can be better at preventing suicide. Funding for suicide research nationally is limited. Just to give you an example, when you compare it to something like breast cancer, and I certainly have had friends affected by breast cancer, and I've donated to breast cancer research myself, but the funding for breast cancer research is tenfold what it is for suicide, as an example. Joshua Gordon, who's the fairly new head of NIMH, has pledged to make suicide research, suicide prevention, a priority. So I'm happy to hear about that too. We talked about a lot of topics today that were important. I can't cover all of them. I will mention that we have a shortage of mental health providers. For physicians, the money for training new physicians, whether it's surgeons or psychiatrists, was frozen in 1997. So we're going to have all sorts of shortages, but especially with psychiatry. We need help nationally. We'd like to have a 3-digit hotline for suicide crisis. We have 911 when there's a car accident or a medical crisis, but we'd love to have a 3-digit line. When I'm in a room full of doctors and I ask them what the hotline is, the suicide hotline, very few of them know it. So if the doctors don't know it, the parents don't know it, the kids don't know it. So we need help with that. There's been a lot of talk over the years about mental health parity. It's never really panned out. Funding for treatment of folks that are struggling with mental illness is difficult to find. Not only find providers, but then to find somebody that has the insurance you have, or to get reimbursed at the same rate, or to have the co-fee be the same. And I think that's part of why we have a national shortage of inpatient beds in a crisis. Sometimes there aren't any. We talked about gun safety. We respect people's right to have guns. We respect that, but we also want them to be able to voluntarily protect their family members with a trigger lock or safe storage. And we're working with Guns Rights Group, as well as people that are trying to reduce the rate of suicide, and really work together as a team and come up with things we can all agree on. We have, there's NIMH. It's hard to get grants, but there are some grants for. Sometimes you can get a grant for science. Funding's very tight. And then we have Samsa Grants, which if you've got a program you've shown to work in the community on a small scale, you can use a Samsa Grant to expand that funding. But in fact, for community programs, there's really no funding agency to test or to look at program evaluation for community programs. So that's another short area. Having worked on this for decades, I am so pleased that in the last 5 years, our work on suicide prevention in the state has doubled and tripled, and I appreciate all the legislators, the governor, the Huntsman family's recent donation, and everyone that's really coming together from all sides to work on this issue, and I'm very thankful for that.
Thank you. Representative Eliason.
Thank you. Thank you, Congressman McAdams. Thank you, Dr. Gray, for this opportunity, for your focus on this critical issue. Dr. Gray is the pioneer of suicide prevention in Utah, in my opinion, and so this is an all-hands-on-deck issue. You may ask the question, why are we here today? 2 sobering statistics. 1, suicide is the leading cause of death for our children in the state of Utah. That's not acceptable. 2, on a national basis, for the past 3 years, we've seen a decline in the average lifespan of Americans. We have not seen a 3-year decline in over a century, which was due to the Spanish flu in World War I. And that decline is being driven by deaths of despair, of which suicide is a key driver. So this is something we know we can do something about. This data was just released, and it's extremely encouraging by the Department of Health, that in 2018, Utah saw the first decline in our suicide rate in approximately a decade. It was very small, but what that tells us is that we can do something about this, and some of our efforts are starting to work, but now is not the time to let up on those efforts. So again, thank you for the continued focus on this. We have much work to do. In terms of really simple things, I'll just take this opportunity to encourage everybody, parents, friends, family, to watch for the warning signs, learn about gatekeeper training, how to reach out to somebody who may be in need. You can download the Safe UT app. I'd encourage parents to have their children download the app on their phone and encourage them to use it. They can get crisis support 24/7, 365 with experts at the University of Utah Neuropsychiatric Institute that are trained to work with children. One of the most important things we know that parents can do is safely secure their firearms. That could reduce our youth suicide rate almost 50% if that simple step was done. So again, we need to continue these efforts and appreciate Congressman McAdams' focus on this. Thank you.